Motivational interviewing is a person-centered, evidence-based, goal-oriented method for enhancing intrinsic motivation to change by exploring and resolving ambivalence with the individual. Motivational interviewing is the backbone of SBIRT. It's motivational interviewing that assists the patient to make positive behavioral changes. Motivational interviewing is focused on competency and strength. It affirms the client, emphasizes free choice, supports self-efficacy, and encourages optimism that changes can be made. Motivational interviewing is individualized and client-centered. Research indicates that positive outcomes are associated with flexible program policies and focus on individual needs. Motivational interviewing does not label. This method avoids using names, especially with those who may not agree with a diagnosis or don't see a specific behavior as problematic. Motivational interviewing creates therapeutic partnerships. It encourages an active partnership where the client and counselor work together to establish treatment goals and develop strategies. Most people conceptualize therapy as a clinician sitting across the desk from a client imparting wisdom. Motivational interviewing is an approach that places us beside the client and allows us to help the client elicit change on their terms. Motivational interviewing uses empathy and not authority. Research indicates that positive outcomes are related to empathy and warm and supportive listening. Motivational interviewing focuses on less intensive treatment. This method places an emphasis on less intensive but equally effective care, especially for those whose use of drugs and alcohol is problematic or risky, but not yet serious. The goal of motivational interviewing is to create and amplify discrepancy between present behavior and broader goals by creating cognitive dissonance between where one is and where one wants to be. Most treatment attempts to comfort the afflicted. The goal of SBIRT is to afflict the comfortable by helping the patient recognize the difference between where they are and where they want to be. Like all clinical approaches, motivational interviewing assumes the following: acceptance of the client, autonomy or choice. The client has the best idea in the room because at the end of the day, that's what the client will do. Less is better. Elicit versus impart. The idea that ambivalence is normal. Carefrontation versus confrontation. Non-judgmental. Listening for change talk. Avoid the writing reflex. We want to fix the client, but the client might not be broken. The motivational interviewing shifts us from feeling responsible for changing patients' behavior to supporting them in thinking and talking about their own reasons and means for behavior change. This is the idea of being on the same side of the table as the client. Here are 3 acronyms we incorporate with the motivational interviewing process. DARNCAT is an acronym we use to remind us to listen to specific words that imply that the patient is moving towards change. Desire, things like I'd want to, I'd really like to, or I wish. Ability, I would, I can, I'm able, or I could. Reason, there are good reasons to change, or this is important. Need, I really need to. Commitment, I intend to, I will, or I plan to. Activation, I'm doing this today. Taking steps, I went to my first group. These are different types of change talk. Change talk is patient speech that favors movement in the direction of change. Using the ORS approach gives patients the opportunity to talk themselves into considering making behavior changes. Open-ended questions. Affirmation. Reflective listening. Summary. All of these things can elicit change talk. The EARS acronym provides suggestion for responding to change talk. EARS reminds us to elaborate by asking for more detail, affirm by making positive comments, reflect what the patient says, or summarize the patient's comments. The following important counselor responses will also aid the motivational interviewing method. Repeating or reflecting what is said.
I don't want to quit smoking.
You don't want to quit smoking.
Rephrasing, which is altering the statement slightly.
I really want to quit smoking.
Quitting smoking is very important to you.
Altered or amplified, adding intensity or value to the discussion.
My smoking isn't that bad.
There's no reason at all you should be concerned about your smoking.
Note that it's important to have a genuine, not sarcastic tone of voice. Double-sided. This helps reflect ambivalence.
Smoking helps me reduce stress.
On one hand, you said that smoking helps reduce stress. However, on the other hand, you were saying it's causing stress. You have a hacking cough, you have to purchase cigarettes, and you have to smoke outside.
Metaphor. Create a picture for the patient.
Everyone keeps telling me I have a smoking problem, but I don't feel it's that bad.
It's like everyone is pecking at you about your smoking, like a flock of crows pecking at you.
Shifting or changing the focus.
What do you know about quitting? You've probably never smoked.
It's hard to imagine how I could possibly understand.
Reframing. Offer a new meaning.
I've tried to quit and failed so many times.
You are persistent even in the face of discouragement. This change must really be important for you.
Paradoxical, or siding with the negative.
My smoking isn't that bad.
Smoking is a good choice for you. Why would you want to change?
Again, it's important to have a genuine, not sarcastic tone of voice. Emphasize personal choice. It's up to you.
I've been considering quitting for some time now because I know it's bad for my health.
You're worried about your health and you want to make different choices.
The following visual rulers can also be utilized by counselors when working with patients. Humans seldom do anything that they don't believe is important. The importance ruler requires the patient to state specifically how important change is to them. Asking them why they didn't choose a lower number will require them to discuss the reasons that change is important. Asking them to explain what it would take to move to a higher number provides you with the information that can be reflected back. Often, the responses are about additional negative consequences. The readiness ruler is a question about motivation. It provides the patient with an opportunity to explore their readiness to make a change in their substance use behavior. Asking them to explain why they didn't choose a lower number requires them to discuss the reasons why they are ready. Asking them to explain what it would take to move to a higher number provides you with information that can be reflected back and help them to find ways that their readiness can be increased. The more confident a person is, the more likely they are to try something new. The confidence ruler provides the patient with the opportunity to explore their level of confidence related to changing their substance abuse behavior. Asking them to explain why they didn't choose a lower number will require them to discuss the reasons they feel confident. Asking them to explain what it would take to move to a higher number provides you with the information that can be reflected back and helps the patient to find ways that their confidence can be increased. We often experience pushback or zingers from clients. This is the resistance or denial or even excuses from patients that come in innumerable forms. Here are a few examples. Look, I don't have a drinking problem. My dad was an alcoholic, now I'm not like him. I can quit anytime I want to. I just like the taste. That's all there is to do in Lancaster. Here are a few possible suggestions for handling those zingers. I'm not here to push you to change anything that you don't want to change. I'm not here to convince you that you have a problem or are an alcoholic. I'd just like to give you some information. I'd really like to hear your thoughts about, and what you decide to do is up to you. To summarize, the goal of motivational interviewing is not to make the client see that what they are doing is unhealthy, detrimental, or even problematic. It is not to force change. Motivational interviewing is a collaboration of skills that clinicians, therapists, and doctors already possess to help elicit change talk from a client. It is the treatment modality that is used to help assess the client's readiness, confidence, and importance of making a change, and to aid the client in making their own decisions in any area of life through the creation and maintenance of a therapeutic partnership.